The opposition NDP says the lack of reliable ambulance service should be one of the government's top priorities.
It's really disappointing to see a government that is failing on so many fronts, and we see them failing when it comes to access to ambulances when people need them.
According to Saskatchewan Health Authority figures obtained by the NDP, there were more than 1,100 instances in the past 8 months where no local ambulance was available. That total doesn't include Saskatoon, Prince Albert, and other communities served by private ambulance companies. Regina had the most, with more than 300 instances where no ambulance was available. But even some much smaller communities such as Cutknife and La Loche still had dozens of these cases.
I think, everyone expects that when you call for an ambulance and you're in an emergency situation, one is going to be available. So it's jarring and incredibly concerning to see data that shows this is a daily occurrence where there are multiple times a day. It averages out to about 5 times a day in the last 8 months where there's no ambulance available when someone calls.
The head of a group representing ambulance companies agrees it's a growing problem.
Absolutely, it's a concern, not only for us here in the province, but nationally it's an issue. I know, that's happening more and more everywhere.
Skarodko blames the service disruptions on several factors. He says there's a shortage of paramedics across Canada, and in Saskatchewan alone, 150 vacant positions. Hospitals are also crowded, he says, and when an ambulance comes to the hospital to drop off a patient, that ambulance can't leave until a spot's been found for that patient. That can sometimes take several hours, he said. Saskatchewan's Health Minister, Everett Hindley, says there are more training spaces and incentives available for paramedics. He says they're working closely with SHA officials to find solutions.
We want to ensure that, number one, that as we're training people, that we're keeping them here in Saskatchewan. I think that would be our utmost priority. But secondly, we also need to try to do as much as we can within what limits we have to ensure that we are filling those vacancies that we have in our ambulance services with these graduates that are coming out.
Hindley says he plans to meet with paramedics and other groups in the coming days. He says they are working hard to address the problem. Mowat hopes that talk will be followed by action. Jason Warwick, CBC News, Saskatoon.